Okay, I want to take a second to talk about the lip biopsy for Sjogren's diagnosis and the comment that this individual left on one of my videos. In case we haven't met, my name is Heather. I'm a Sjogren's patient and advocate, sharing information and resources based off of my journey to help other patients on theirs. I do want to just state that I am not a pathologist. I do not have technical training in this. I am just going to share my opinion based off of what I know as a Sjogren's patient and advocate for individuals with Sjogren's. So the lip biopsy is a diagnostic test that they use to help diagnose Sjogren's disease. And what they do is they take out some of the salivary glands that are inside the inside of your lip, and then they send it off to the lab. Now, when they do that, the pathologist is going to look at what they need to look at, and what they're looking for is a certain amount of inflammation inside of those salivary glands. So in this case, when the pathologist said that you do have fibrosis of the salivary glands, but not a high enough lymphocytic focal score, what that basically means is that they are starting to see swelling, scarring, and inflammation inside of your salivary glands, but not enough to be considered positive for a Sjogren's diagnosis. So in other words, what I've seen from other patients that have had this kind of feedback, they consider it to be inconclusive. Not negative, but inconclusive. And if I were reading between the lines here, what I would see is that you do have inflammation inside of your salivary glands, but not enough to be considered positive for Sjogren's. Something to keep in mind, if you do get a result like this, I would go back to my rheumatologist and ask them if you could possibly be a seronegative Sjogren's patient. Seronegative basically means that you have negative blood work or a negative lip biopsy, but you still have the disease, and up to 30% of Sjogren's patients are seronegative. So I would be, there's an article on PubMed that you can look up and print out and bring into your rheumatologist to ask that question if you are currently looking for a Sjogren's diagnosis and got these kinds of test results on your lip biopsy.